Dear students, today we'll discuss instrument, an instrument rather than clinical case, just to find out what this instrument is. Look at that, finger bow is there, long proximal, this one, slot is there, and right angle is there, like this angle, with the serrations in the tip. So what is this instrument? So this is the mixters, both spellings are there, mixters or mixters, right angle forceps. It is a very useful instrument to detect in the depth and create planes, vagotomy, in GA surgery, in the deeper plane, thyroid, in the axilla, breast dissection, axillary dissection, and anywhere in the deeper plane, or when you dissect a major artery across to pass the loop, in urology open surgeries, or GA open surgeries, or anywhere, even laparoscopically right angle instrument is there. So it creates your, allows your dissection properly. So very, very useful, essential instrument rather in surgical practice, especially in the major surgery. Small size, medium size, large size is there, and different curvature. Small right angle it is, but length, distal tip length may be small, medium, or quite large, depending on the how deeper, how wider, how lengthier dissection you are going to do across a tubular structure as such. So when you dissect the CBD, portal vein, major veins, IVC, vascular surgery, major surgeries of any type, this is a very, very essential instrument to go ahead with your proper surgical dissection as such. That's why this is very useful. Different size and different tips also come in this instrument, depending on the requirement of individual specialized surgeons as such. So this is the Mixter's right angle forceps. So for detail about that, you can read my operative surgery book or manual book and or clinical book. All I got for instrument chapter. So you can learn about this instrument, all other instruments, every instrument also there in these chapters. Students, so please, again I request, subscribe my YouTube channel and press the bell, and also share the channel with your friends and colleagues to update their surgical knowledge about clinical daily cases and instruments, specimens, x-rays, images, brief operative procedures, and so on, everything. And once in 2 days live session, which comes in a distance to discussion about case presentation for more than 1.5 hours with the other senior faculties other than me, be around in the online, so that you can always join the chat, so that I have the interaction with you. And also entire thing topic is discussed, like entire thing will be discussed, to examination, to history, to management as such together. And also whoever join live will get a certificate which will be very, very useful for your future career. So what is this instrument? Identify this instrument and put the right answer in the comment box. I will appreciate your answer. So A, B, C, D, what is this instrument? Find out and answer the MCQs. Identify on table finding. What is this on table finding? Look at that. So what is this exact finding? A, B, C, D, and put the right answer in the comment box. I will appreciate your answer. And quotation of the day, students: patience and silence are two powerful energies. So when you don't want to speak, don't speak. Your expression should speak. And patience to listen somebody or keep quiet when you are not able to answer anything, when you don't know anything, or keep quiet yourself whenever needed. It's called patience and silence. Makes a lot of difference in your life, makes your things calm and cool. Students, and also go through my SRB's Manual of Surgery current edition for in detail subject matter with the MCQs online, and everything in Oxy is covered, from general surgery, endocrine, thyroid, breast, parathyroids, GI surgery, everything, liver, gallbladder, GI tract, stomach, hernia, urology, specialties, cardiothoracic, neurosurgery, basics, instruments, specimens, anesthesia, and briefly recent advances with a lot of illustrations, photos, quotations, and treatment strategy, management policy, principles, with a lucid, understandable language. With the wherever Oxy topics are there, also it is covered for both UGs and PGs. So make use of my SRB's Manual of Surgery for your better understanding of surgery knowledge as such, and also my SRB's clinical methods in surgery. It is It covers all clinical examinations, general surgery to hernia, thyroid, breast, varicose vein, vascular diseases, GA examination, abdomen, briefly orthopedic, and with the instruments, specimens, and briefly images as such. Video examination of the each topic, each chapter, which will very, very useful for your clinical examination, and principles of examination with a lot of photos and brief differential diagnosis in tabular form. But it doesn't contain, because it is a clinical book, it doesn't contain any management policy. For management policy, you have to go through the SRB's manual of surgery. But clinical book, it is very, very useful. Everything in detail it is there. So please purchase my clinical book and manual of surgery to have a complete understanding of the surgery as such. And my operative surgery current edition with the 2-volume extensive book, about 10,000 photos and illustrations, very, very useful for upcoming surgeons, surgical surgery PGs, and practicing surgeons, in detail, step by step, all procedures, even GI surgery, general surgeries, endocrine surgeries, everything, step by step, with a lot of photos and illustrations, with the instruments, energy sources, everything it is covered. It will be very useful for all surgeons who is practicing. Before surgery, they can go through the steps and do the procedure skillfully without much problem. So please go through my SRB's operative surgery atlas and guide, atlas actually, test and atlas, current edition, 2-volume book, very, very useful. Definitely you'll understand the technique, small procedure to big major procedures as such. My SRB's tissue approximation, again brief small atlas book, 100 pages, which shows how to approach different suturing techniques, different methods, different types of suturing, different skills of suturing, different suture materials, and skin suturing, deeper tissue suturing, bowel suturing, laparoscope suturing, with the principles, and also with the video of suturing. How to do all suturings or videos are there. That also very, very useful for all students. So please go through that, my SRB's tissue approximation book also. So students, again I request to subscribe my YouTube channel to have a best surgical update as such, a daily, day-to-day basis for your clinical knowledge, image-wise, and also join live sessions once in 2 weeks for extensive knowledge about the clinical discussions for more than 1.5 hours. So again request, please subscribe my YouTube channel, share with your friends and colleagues, and press the bell. So students, I hope you have understood this lecture very well. Thank you so much.